The stay-at-home order here in San Diego County has been extended at least another 3 weeks. The state announced that decision today as our region's ICU capacity remains at 0%. So here's a look at the new numbers that are just out today. More than 2,500 more new cases being reported. 15% of the tests were positive. 31 more deaths also being reported. Right now, nearly 1,600 people are hospitalized, including 388 who are in the ICU. And joining us now to talk about all of this, San Diego County Supervisor Nathan Fletcher. Supervisor, thanks for joining us. Can we start with that ICU capacity? Because we've been considered as a region at 0% for weeks. But what is the situation here in San Diego? It doesn't mean, as you and I have talked about, it doesn't mean there are zero beds, right?
No, we have a handful of beds, and even here in San Diego County, the real challenge is staffed and available beds, which fluctuate every single day. I mean, we may run where we have 20, 25, and hospitals are doing incredible work of basically discharging or offloading or canceling procedures of non-COVID patients to create that space so that there is a bed for a COVID patient. But the real concern is staffing, and the real concern, Andrew, is what comes ahead first week of January. As the burden on healthcare workers becomes great, and as the impact of hospitalizations with the significant lag after the increase of cases comes. So very concerning. We're not at zero in San Diego. If you get in a car accident tonight, there will be an ICU bed available for you. But it really is a tremendous strain on our healthcare system, the number of cases and hospitalizations we're seeing right now.
Is there a certain number where we get to where it truly is a zero?
Well, there is. I mean, there is, and we're doing everything we can, standing up federal medical centers. Again, hospitals are changing how they staff, changing team, trying to bring in more types of folks. I mean, everything we're doing is to try and avert that situation of crisis level care, where they have to make a decision of you get care, and you don't. And from the very beginning, that's a situation we've been desperately trying to avoid, and we're going to continue to do that. And I'm hopeful that we can. But we really do need to see a relief on some of the new cases. And we really do. You know, I know it's hard, and I know people are fatigued, and I know there's a lot of misinformation out there. You got elected leaders telling you defy the orders and don't do it, and it's all a joke. You know, you go to any one of these emergency rooms, and they'll tell you clear as day it's not a joke. You go to the almost 1,500 family members of San Diegans who died from COVID, they'll tell you it's not a joke. It's difficult, it's hard, but Andrew, we've just got to come together. We've got to follow the public health orders. We've got to slow this case count and give our hospitals a little relief.
Why do you think it is, Supervisor, that many people believe that or defy the orders? I mean, so many people traveled for the holidays against the wishes of the CDC and so many other leaders. Why is that happening? Are people not connecting what's really happening with what they're seeing with their own eyes?
Well, I think it's a couple things. I mean, look, when you look at us as a country, more than 300,000 dead Americans from COVID, and you compare our death rate to other large industrialized nations, we as a country have done terrible. And I think that squarely goes on the shoulders of the president, who has been erratic and inconsistent in his response and messaging. And what that does is enable, almost half of the population who tends to align with him to say, well, maybe this is all a joke. We should just open up everything. And that enables local elected officials. Look, we have local politicians here in San Diego County that routinely go out and share misinformation and share things our public health doctors have to go and say, well, that's not true. And it just creates confusion amongst the public. And if there was ever a moment where we needed to be unified, Andrew, whether your prime focus in life is opening up a business or your prime focus in life is saving the life of an elderly person or a vulnerable person, we would do the same thing. We would wear the mask. We would avoid the large indoor settings. We would recognize as cases increase, our response has to increase. And that's the only way that we can get out of this. And there really is no other way. And it's just a challenging time in America, an era of epic disinformation, an era of social media toxicity, and all of these types of things. And that's where we really are just pleading with the public. Please trust your doctors, trust the public health experts. No one wants to have anything closed. We just want to get through this as best we can as a region.
All right, talking about things being closed, let's talk about today's news as far as the stay-at-home order being extended out another 3 weeks. Not a total surprise given what we're seeing out there. What's your reaction to that? What do you make of businesses that are just openly defying these orders? And what's the reaction from the county? Are cease and desist letters going to go out? Obviously, as you and I have talked about, so many businesses are just like, we're trying to stay alive here.
Well, and hopefully the recently passed federal effort will really help businesses a little bit. We're bringing back essentially the PPP program. There's augmentation for unemployment. As an individual can't go to work, gets laid off, they're eligible for unemployment, but now it'll be continue to be more generous. And so hopefully some of that, which we really needed over the past 4 or 5 months, but hopefully some of that can ease some of the economic anxiety and concern. Our enforcement posture is going to continue. We will continue to do inspections. We will continue to issue cease and desist notices. But the reality is you're not going to have a functioning economy or a thriving economy when you're in the middle of a pandemic and when you're seeing threats to your healthcare system. And so for our businesses, look, I know it's hard, and these folks didn't do anything wrong, and we're doing everything we can to provide economic assistance and relief. But we have to take the difficult steps of following the regional stay-at-home order. And we have to do that because we want to get our cases down, because we want to save lives, and we want to get our economy back up again. And so we don't have a choice. We can't avoid the difficult situation in front of us. And it is difficult, and it is unfair, and it's frustrating, and all of that's true. But it's also true that if everyone continues to defy the orders and continue to have large indoor gatherings, the situation will get worse, the economic situation will get worse, and the public health situation will get worse, and we desperately need it to get better.
It certainly feels like a catch-22 for so many people out there. Lastly, Supervisor, let me ask you about the fact that today we learned a few hundred San Diego first responders were given the vaccine. What can you tell us, and what do we need to know about the rollout with the vaccine and how it's going for us here in San Diego County?
Well, it's going. I mean, one of the challenges is, and this has been a challenge throughout COVID, Andrew, is we have a very fragmented healthcare system in the United States and in San Diego. And so, a lot of healthcare systems are getting their own allotment of vaccines. And so, we're all trying to adhere. And at the county, we're trying to kind of play a role of air traffic controller. But we really have to adhere to that CDC guidance and follow that process through. It's been put in place for a reason, starting with our healthcare workers. Then go into our long-term care facilities, our most vulnerable folks, our frontline workers. And so, we're going to have to work through that. It isn't going to be a perfect process, but it is good news that we are talking about people getting the vaccine. And that should give us all a little bit of encouragement and hope that 21 is going to be better. I guess every year will be better than 2020. But it is good. The conversation we're having right now is around people getting the vaccine. And that is a pathway out of this, and that should be encouraging for us all.
There is that light at the end of the tunnel. Supervisor Nathan Fletcher, thank you for your time and your insight as always.
Thank you, Andrew.